SecureFit Trendelenburg positioning system delivers a simple, safe, and secure way to position patients for Trendelenburg procedures. The proprietary design combines a uniquely contoured surface geometry and a patient-conforming viscoelastic gel pad to resist sliding and redistribute surface pressure. Flexible and adaptable, the SecureFit system can accommodate patients up to 400 pounds for a variety of Trendelenburg surgeries, including robotic, open, and laparoscopic procedures, including steep Trendelenburg. Setting up the system. Place the TPS foundation onto the surgical table with the wedges toward the top of the table. Please note that a draw sheet can be used on the SecureFit TPS under the foundation as shown here. Slide the TPS stabilizer wedges onto the TPS foundation, making sure the wedges are properly aligned. Place the shorter side of the TPS stabilizer posts into the holes on the stabilizer wedges. Then place the other end of the stabilizer posts into the table clamps and tighten. The clamps feature a round post tip that fits any North American surgical table. Place the TPS Stabilizer Wedge Pads onto the stabilizer wedges. Place the TPS gel pad onto the TPS foundation, with the top of the pad aligned with the tops of the TPS stabilizer pads. Position the smaller cutout at the head of the table, the larger cutout at the bottom. While the patient is awake, lay him or her down with their back on the TPS gel pad and their head between the TPS stabilizer wedges, taking care not to put pressure on the shoulders. The shoulders should touch the TPS gel pad, but without adding pressure to the area. You can ask if the patient is comfortable and make any necessary adjustments with the help of the ambulatory patient. When the patient is positioned properly, there will be a small space between the top of the shoulder and the TPS gel pad. The clinician can ensure there is minimal pressure exerted on the brachial plexus by placing their hand in the space. This space will be maintained when the patient is in Trendelenburg. The anesthesiologist can check periodically during the procedure to ensure there is no focal pressure on the top of the shoulder. Once the patient is under anesthesia, you can access the neck by removing the TPS shoulder supports. When finished, replace the block before returning the patient to the Trendelenburg position. SecureFit allows convenient intubation with or without wedges in place, depending on the preference of the anesthesiologist. The gel pad cradles the patient through the scapular region, redistributing pressure over the entire area of the scapula, avoiding injury to the brachial plexus, and helping to prevent pressure ulcers. It also serves to keep the patient secure in steep Trendelenburg. The SecureFit TPS is easy to clean. Simply wipe down in the same manner as any surgical surface, using the manufacturer's suggested cleanser. Do not immerse. Before storing, make sure the SecureFit is clean and that the gel pad is flat. The SecureFit TPS Trendelenburg positioning system is an innovative approach to positioning that enhances patient safety and increases OR efficiency.
Only personnel familiar with correct patient positioning who have fully reviewed the instructions for use should use this product. This device is intended to secure patients in extreme Trendelenburg positioning and should not be used if the patient has health issues that contraindicate extreme positioning or prohibit proper placement or use of the stabilizer. If sliding or other change to the operating room table occurs, or if the patient is moved after being secured in the SecureFit TPS, it is important that the position of the patient in the SecureFit TPS be reassessed and adjusted if necessary. The patient should be positioned in the SecureFit TPS before the table is tilted into any degree of Trendelenburg positioning to avoid undesired position changes. This device is not for use in reverse Trendelenburg positioning. To schedule a demonstration or order the SecureFit TPS, call 888-225-4633 or visit alimed.com/TPS.
Discover what the AliMed SecureFit TPS Trendelenburg positioning system can do for you and your patients.